Organizing. What's the date of today?
You are live. The 21st.
Okay, good morning. This is Senate Health and Welfare, and today is May 21st. We're here looking at an amendment brought to us by Senators Clarkson, Major, and White, and Senators Clarkson and Major are here to present their amendment on H91. So why don't you share with us what your amendment is, and then we'll have Katie McClendon go through it with us.
Thank you, Madam Chair. And it's so good to be in this room in a formal capacity. Katie, we're glad you're here to back us up. We have two amendments and brought to us by the incredible partners who run our shelters. And they addressed an issue in H91 that they feel needs to be addressed. The first, which is the HOP funding and the housing opportunity program. And the First Amendment is to delete all reference to the changes in HOP funding and how it would be administered. I believe that's the First Amendment. And Katie can will go through these with you. And the Second Amendment is if you are not willing to delete all the language about the HOP funding and how it's being addressed, because anyway, the Second Amendment is to ask that we set up a study committee that would look at through DCF to look at the feasibility of the future feasibility of how the HOP program is funded, but to not assume any fashion in which it would be funded. And I think that, and I know the shelter team is here to probably testify in support of this. Anything you want to add?
Not really. I think we need the data more than anything else, and that's why we want the study, not to just assume, as Senator Clarkson said, anything. To have some hard facts behind what we do.
Okay, because Katie had sent us the language, which it says DCF shall submit a plan. And what I think we're wanting to do, what the shelters are wanting to do, is back up and say, well, we want input on what the plan for the funding might be, not to assume anything of how it would be administered. Is that fair?
Yeah, adding it into the HEARTH program.
Okay,
yeah.
Right. So that is what our
little voice around the room. I know that.
Yeah.
I know that Mark. I know that both you guys would like to offer some comments.
There's a Michael.
Yeah.
There's a Mark Redmond and a
Michael.
Michael Redmond, and you've got Michael today. Thank you.
Mark in your part of the world, Michael and others. So anyway, those are the two options that we talked about, depending on what the committee's appetite was.
Okay.
And I think that they're better and more informed people to discuss it than we.
Okay, so Katie, why don't you walk through both the amendments? Which one would you like to start with, Senator Clarkson?
Why don't we start with the first one, which is, I think, the first choice, which is to delete the references to the HOP funding altogether.
Okay, good morning, Katie McClendon, Office of Legislative Counsel.
Yeah. Hold on, Katie.
Sure.
Okay, try now.
Morning.
Perfect. Thank you.
Good morning, Katie McClendon, Office of Legislative Counsel. I don't have sharing capacity yet.
Sorry.
That's okay.
I think they have copies, right?
There we go. I'm gonna pull up 1.1 to start, if that's okay. Okay, here we go. So as Senator Clarkson said, this is an amendment that would remove references to the Housing Opportunity Grant program from the bill. So as this committee knows, there are several references to that HOP. Most of the references are in legislative intent, as it would take future action to move the grant funding or the HOP funding into VHARTH. So the first instance of amendment is in the legislative intent section, and it removes the reference to HOP beginning in fiscal year 28. And it would just retain the language about GA emergency housing rolling into VHARTH. The second instance of amendment deletes section 5 in its entirety. What section 5 is an amendment effective July 1, 27 to amend the purpose section of the VHearth chapter. And the amendment is to include HOP as part of VHearth. So that whole amendment, that whole section would be deleted in the bill. The third instance of amendment is to section 11. The current section 11 in your bill is divided into two subdivisions. The first addresses general assistance emergency housing and fiscal year 27, and the second subdivision addresses HOP in fiscal year 28. And so I've just removed the second subdivision and made it into one paragraph addressing general assistance emergency housing. And then the fourth instance of amendment deletes section 12. Section 12 is the plan from DCF as to how the transition of HOP into VHearth will happen prior to fiscal year 28. So that whole section is being removed in this proposal. And that's it.
Okay, so essentially deletes HOP from the bill.
Yes.
Okay, and would leave HOP under OEO.
Yeah, it would just be silent. So the
Okay.
Mhm.
I'm looking around the room for someone from DCF and thinking, I understand that you may not have a response to this at this time, because it's the first time you've seen it, but it would be helpful to know your response to this particular amendment. And then,
I'm working on getting a response to that.
okay, good. Okay, so that's one. So let's go, any questions of Senator Clarkson or Katie? Okay, next one is H91, also an amendment from Senators Clark, Major, and White. Seems like you have a common geographic location.
We have a team that functions pretty well.
Okay, here's the second amendment. It's labeled 2.1 on the website for today. And this is an alternative to the first amendment that you've seen. This adds a new section 8A, which creates an advisory committee to determine whether HOP should move into VHearth. And there's a group of community providers and a few folks from the administration who would be serving on this advisory committee. It's a little bit different than the Section 12 plan in that the Section 12 plan is done by the department and sort of assumes that you are moving forward with the transition of HOP into VHearth, whereas this group has sort of a wider base of stakeholders and asks the question of whether the transition should happen. So to go through it, we're creating this group to determine whether HOP should transition to VHearth on July 1, 2027. The membership of the committee, this language should look familiar because there was an advisory committee looking at different topics in the House version of the bill, but this membership and language tracks with the House sent over. That the advisory committee's membership shall reflect to the extent possible the growing diversity among Vermonters, including individuals who are Black, Indigenous, and persons of color, as well as with regards to socioeconomic status, geographic location, gender, sexual identity, and disability status. It shall be, it shall be composed of the following members: 5 representatives with lived experience of homelessness appointed jointly by the Chittenden County Homeless Alliance and the Balance of State Continuum of Care. At the top of page 2, 5 representatives, 1 appointed by each of the community action agencies, 1 representative appointed by the Chittenden County Homeless Alliance, 1 representative appointed by the Balance of State Continuum of Care, 5 representatives of local housing coalitions, including at least 3 of whom are shelter providers representing diverse regions and program services, appointed jointly by the Chittenden County Homeless Alliance and the Balance of State Continuum of Care. 6, Subdivision 6, the Deputy Commissioner of the Department for Children and Families Economic Services Division or designee. And lastly, the Director of the Department for Children and Families Office of Economic Opportunity or designee. And then we get into the responsibilities of this advisory committee. The committee shall address whether transitioning HOP funding and duties to VHearth would reduce administrative costs connected with administering HOP, whether community action agencies would more effectively and efficiently administer HOP than DCF's Office of Economic Opportunity, the top of page 3, how transitioning HOP funding and duties to VHearth would impact the ability of VHearth to provide consistent and effective technical assistance and monitoring across all Vermont regions. Subdivision 4, how transitioning HOP funding and duties to VHearth would effectively integrate with the existing homeless response infrastructure coordinated through the continuums of care and local housing coalitions, and the impacts of potential reductions in federal spending for affordable housing and homeless response and prevention on the proposed transition of HOP to VHearth. So those are the responsibilities. In terms of assistance, this group would have the administrative, technical, and legal assistance of DCF. They would provide a report by January 15th of 2027 before the HOP transition was set to take effect. It would be a written report to the various policy committees and to the Commissioner of DCF with findings and recommendations for legislative action. The Deputy Commissioner or designee would be calling the first meeting to occur on or before July 1 of 26. The advisory committee would select co-chairs among its, I should say from among its members at the first meeting, at least one of whom is not a state employee. A majority of the membership shall constitute a quorum. In Subdivision 4, the advisory committee may divide into subcommittees to carry out its duties under this section. Subcommittees may include individuals not appointed to the advisory council pursuant to this section, including representation of individuals who are older Vermonters, individuals who have disabilities, substance use disorder, or a mental health condition, individuals reentering the community after incarceration, individuals transitioning from the care and custody of the commissioner, and families and children. The advisory committee shall cease to exist on February 1, 27. And then the members of the advisory committee shall be entitled to a per diem compensation and reimbursement of expenses for not more than 12 meetings. And the payments would come from monies appropriated to DCF. And that is it.
Okay, thank you. And I'm gonna turn to DCF right now and say to ask for comments on this as well. Good.
I'm still Nellie Marvel for the record, DCF. I'm working on Lily Sojourner was unable to be here today, so I'm working on getting
Okay,
her input on what the impact of this would be of the advisory council as well. So I will hopefully have something for you.
okay, good. That would be helpful. I mean, she is responsible for HOP, so.
Yes.
Got
Yeah.
comments for both.
Mhm.
All right. Martine, any questions that you have at this point, Senator Gulick?
No questions. Thank you.
Okay, all right. Senator Clarkson.
So, Katie, I noticed that you put the date of 26, July 1, 26. And I guess I would love to ask the room, is that really what we want, or do we don't want it to have it start this? in
27,
July?
It's your amendment.
No, I know. I just noticed that as you went through it. Do we want it starting in 25 or 26?
Oh,
That Michael Redmond, I have to turn to you. I have to.
it's
Okay.
no earlier than 26. So
Okay.
the idea is to
But
have
what
this operating while VHearth is up and running, because that the administration of that transition, taking on a general assistance program first, is important to see how that flies.
Thank you. As you know, I'm not part of this world, so I'm not clear on the timing.
It's understood. And you're representing a group of people who have been very concerned about this issue from the beginning. And I will say that this committee has taken testimony on it and is empathetic to the concerns, which is why we have in the bill some decision-making process that will help. There is no interest, I want to share with you, there's no interest, as I have said before, I think we've all said, in undoing the work that the HOP is doing, and it's doing at the local level, or undoing the work of the shelters. They are outstanding. Okay, just so you know that. So just let you know that. Okay,
I sadly have to go back to oversee the committee tonight.
Well, then you better get going, but I appreciate your coming in and sharing this and representing the group, because I know it's a.
Well, they are very ably able to represent themselves, but to get on the table, as it were, they needed to engage us.
I
So,
will say one thing about the advisory committee that you've recommended. It is very much similar to a statewide advisory committee that was in the bill as we received it, and actually for a different purpose. And
you mean the composition was?
yeah,
Yeah. Well, good luck, Madam Chair, and thank you, committee, for listening to us. And I am going to go back to economic development.
okay, thank you.
Thank you.
May I just give Senator,
Enjoy agriculture.
Oh. Goodbye, Katie. Goodbye, Martine.
before you leave the
Katie's
room,
trying to say something.
Oh, yeah.
sorry,
Martine,
before you leave the room, I caught a typo as I was walking through, so just please check your email. I'm gonna send you an updated draft 2.2.
right. Go ahead.
Okay, thank you.
I'm sure the chair has
Okay.
patience for typos.
Thank
They're the
you.
least of our problem at this point in the year. Well,
Thank you. Thank you.
Thank you.
Good job.
Katie, I saw your screen light up. Did you want to share anything, or was that just a lit up screen?
No, I just wanted to make sure that the senators were checking their email for the updated draft.
That senators what?
Checking the email for the updated draft.
Oh, okay, thank you.
Thank you.
Yeah, got it. All right, good. Okay, committee, Nolan, you what, joint fiscal?
Just a quick comment, Noel Langwell, Joint Fiscal Office, for the record. Given the size of the committee, the per diems would actually be about $25,000. Now, that said, there's money, when it's below 10,000, I usually say it's nominal. Now, the language says it comes out of their budget and there's money appropriated in the bill. So I think the money is there, although 26, it's July 1, 26, so it wouldn't be a 25 impact. It's a future impact, and it comes out of money that's going to be appropriated, so I don't think you need additional appropriation for it, but it
We
would
need
be
to
in the,
hold on to it.
it would be in the fiscal note, or it would come out of future HOP money, and there's $30 million that goes to HOP. You see, I put it aside. My point is, a committee of that size does have an impact on per diems. Like I said, the money is going to likely be there through the other appropriations, but any fiscal note I would do would flag that it's up to $25,000. Obviously, given it's 17 members,
Okay,
that would be eligible for per diems. Just wanted to flag that.
thank you. Good flag. Right, because the bill was voted out of appropriations yesterday. It is on the calendar for a presentation tomorrow. That's where we are.
I don't think it needs an appropriation. I'm just flagging that.
No. And it's 26. Okay, so I will allow for a quick comment around the room. I know that you're dying to do that, and then we are going to hear from DCF, and then the committee will have to consider this. We'll have a short discussion after comments and letting you know that our discussion will be around the table. So we're limiting comments to this. We've been through this multiple times as we've looked at the bill. So go ahead.
Thank you so much, Madam Chair. For the record, my name is Angus Cheney. I'm the Director of the Homeless Prevention Center. We're based in Rutland. We are a HOP provider, among other things. That includes emergency shelter, rehousing, prevention, outreach, port entry, and a few other programs. And we have about 16 colleagues around the state, including my two colleagues here who are very pleased for the opportunity to have you hear these two amendments from Senator Clarkson and her peers in Windsor County. They're so important to us, and I will respect the fact that we're keeping these comments brief. If I speak quickly to the two amendments, I would say our group is in full support of the first one because it is the cleanest option, and it does not prevent the legislature from doing whatever it chooses in subsequent sessions based on how VHART is going. We think that's the cleanest option. We certainly think that Amendment 2 is better than current language in H91 in that it asks the question, should we, and not just when and how, in terms of transitioning all the HOP resources to this VHART model. The only thing I will add on timeline, because it came up in the senator's presentation, is we would much prefer a timeline that allowed the CAP agencies to operate the GA version of VHARP for a full year.
So you're getting into other parts of the bill with the
Right,
timeline, so I will not allow those comments at this time. So, and I appreciate what you're saying.
Yeah, if I
We
could just
have-
close by saying for us, it's about more than money. This is
I
blood,
understand.
sweat and tears that has been built up over many years. So thank you so much, Senator.
Yeah, no, I appreciate it. I've heard that. I've heard it, idiosyncratically, it's all about the money. Well, for me, it's not about the money. It's about having a system of care that is going to work. Integrated system of care that's going to work. It doesn't mean we're changing. Just might be doing better outside of, anyway.
And
Okay,
one more thing specific to HOP, which is the only potential tripwire I see in the Second Amendment is around the composition of the study committee. And I would just hope that could be, if that's the route that the legislature pursues, that the study committee is composed in a way that doesn't generate a foregone conclusion. If you loaded all of us up on it, you can imagine where we would go. And the same could be said if it was a group of people who were very pro moving HOP to VHARP. So that I think that's why I say the first option is your cleaner option. Thank you very much.
yeah, thank you.
Your hands down.
I'm not sure that the current language does that either. Anyway, Michael, you want to make?
Just add, in regards to this study committee, I'll work backwards on that, Commissioner Winters, when he came before your committee a week ago, said that the administration was open to that as an idea. And I think that one of the members of your committee actually raised that initially.
Senator Gulick raised it.
Yes.
It's absolutely true.
Yeah.
We did talk further with AHS and they were less enthusiastic.
Okay, well, here we are. We're enthusiastic again for
I got
that.
it.
Yeah,
I understand.
and the bill came apart, came together in the House without any input from the organizations that provide this work, and limited opportunity subsequently. We are in favor of the challenge that the CAP agencies are ready to take on. We think don't want to underestimate it, and want to make sure that the second part of it is thought through, which is what we're asking for.
Understood.
Yeah.
No, I think we all agree on that.
Yeah.
Yeah, it can't be a knee-jerk response. Understood. Okay. Is there anyone else who'd like to offer a short comment? Hey,
Michelle River for VCAP. I will just say, based on conversations among the CAPs, I would say they would oppose both of these amendments.
okay. So,
Brenda Siegel and Homelessness Vermont. I just wanted to say, I'm not gonna comment on the amendments, but the advisory committee, which is, if they were to go in the second option, I would want to make sure that someone from Vermont Center for Independent Living was appointed, so that there was a disability representation on the committee.
okay. Okay, anyone else?
Nellie Marble, DCF. I would just say that the department is likely to be neutral on these amendments. We think it might be more productive to rather than having the advisory committee be the one submitting a report, have the department work with input from members of the advisory committee, and then have the department be the one to submit the report. But I think generally we're neutral on these amendments.
Of course. Question for you, for the DCF, is, should the bill go forward as it currently exists and DCF is responsible for developing and making the report, would the process include reaching out to interested parties, including shelters and HOP and all the interested parties, to come to some decision?
Yes, I think we would want to make those decisions in collaboration with all of the interested parties.
Okay, thank you for that, everyone. This is like deja vu all over again for us, but I do appreciate the work that you're doing and the interest. You're looking out for your own interests, and that's important. And we understand that. We also understand that the decision making on HOP is not imminent. It is period of time. First, CAPS need to organize and coordinate through whatever VHARS ends up looking like. And then a discussion about what it would look like for some of the work that HOP is doing, integrated in with CAPS or CAPS integrating the other way. So there's a lot of process that has to happen before any changes are made here. So committee comments.
At a committee of conference, so I didn't hear the first one.
Huh?
I was at a committee of so I didn't hear the first part of the testimony.
The first part is to delete any reference to HOPs whatsoever. And the second is to add an advisory committee that will bring back recommendations for how and whether HOP is integrated in with the CAP VHARS program. Okay.
Feels like deja vu.
It does. It does. So Martine, any thoughts from you?
So I'm sorry I can't be there this morning. Windsor is not the only district that's heard from their HOPs. I think it's been, a fairly universal response. At the same time, there's a lot of work's gone into this, and I think we all respect the work that the HOPs do, and we value their work. And at the same time, we're trying to put together a system that's coordinated and organized and somewhat centralized. And I think that we're getting there. So I don't want to derail the work that's been done thus far.
Okay, it sounds like you're not supporting the amendments that are here. I am not supporting the amendments that are in front of us. We have had this conversation. I don't think that there's anything that is in the works to undo the great job, support, financing of HOP and of the shelters. I think they're very, very, very valuable, whether you're in Rutland or White River Junction or Burlington. Those shelters or Washington County, they're really important.
I was told that the shelters were included in the House discussion.
Now, in the House bill that has come to us, the shelters didn't have an opportunity to talk to the final bill as was passed out. They have had an opportunity to talk to it.
That's what I understand. But it is, I voted against it.
I know. Well, how do you want to add this? What are your thoughts on the amendments? I'm turning to everyone here. I've said my piece.
I think if we manage to transition the GA housing to the CAPS, then we can deal with everything else later.
And that's the way. That's the way.
Suspicion is, and it was confirmed with the discussion last week of the last day, that the administration is just trying to offload the responsibility and cut the funding, and I think that's going to be the first battle.
Right, that's the big battle.
And if housing vouchers are killed at the federal level, we're going to have a war to fight.
Right.
And I'm willing to give, I think the CAPS, if we adequately fund them, can do the job. But part of that is working with your shelters.
Yeah.
I mean,
that's the way I feel. Shelters should be involved.
specifically Tulsa more shelters.
Yes. With similar.
Yeah.
Operational. Administrative. Work.
Is that sounds
I know, it's loud.
on a Wednesday?
It's some sort of, pound to the dome or something like that. We looked on the calendar.
It does not feel your alive.
Yeah.
Can
It's Habitat for Humanity. They're building walls. Well, we discussed housing and if they're going to move them to a house.
Oh, what's this Habitat for Humanity Day?
It's, yeah, they're, yeah. Yeah. Oh, yeah, I see the Habitat. for Humanity.
And they're replanting taking the tulips out for perennials.
Okay, so committee straw poll. It's supportive deleting every comment in the bill regarding HOP. Anybody support that? Okay. Opposed to that one? Opposed to deletion, okay. Okay, straw poll, having the advisory committee of 17, 18 people, and missing VCIL, having the advisory committee determine whether HOP should be included. Okay, those who support that. Okay, those opposed. Okay, that's your answer.
That's our.
Well, we did something together. Martine, we all voted no on both of those, but you didn't raise your hand, so.
I'm in agreement with the committee. Thank you.
Thank you very much, Senator. I appreciate it. So I understand people's concern about HOP. You have to understand that we are also empathetic and concerned about HOP.
Well, we will consult
And we will.
before we make a decision.
Oh, my God.
We will consult with everybody that's in the room.
That's right.
I mean, that's how this process works.
Yeah. We don't ignore. We do not want to ignore. It's critical. Well, thank you all. Is Jen coming in?
Yeah, she's waiting for you.
Oh, good. So we're ready to talk with Jen. So we're
Thank you very much for the time.
Thank you all. I appreciate everything you're doing. I understand your perspective. Keep us honest.
Thank you.
And just.
Thank you.
That's okay. Cheers.
Yeah, but what's the next one?
Bigger conversation.
How's it going?
Well, yeah.
Walking through S-126.
Okay, maybe we should do that another day. Okay, so can we walk through the what you call it, resolution? Sure. Let's do that. Martine is up on the screen, the resolution that we're writing. What do you need is what? That's on the house.
Well, I have the house.
Oh, okay.
I just wanted to, I'll be honest, 126 was a while ago.
Reference based pricing.
Okay.
Yeah, that one.
That's
You want to ask you?
As the Senate passed, so we could. I mean,
And we will ultimately, we'll get a side by side. 'cause
Yes,
how-
and that is a markup.
That's the mark.
So
So wait,
that's showing you
for the
all the
side.
changes, but
Yeah, I
yeah, if
know.
you want to be able to look at
Yeah.
something and see just what it was. That's helpful, and I can send you section by section if that's helpful of the Senate version.
Yeah, we'll want all of that stuff.
Yes, and I'm working on putting together an actual side by side. That I've also been
Awesome.
tracking as it goes through that
How
house.
Katie left. That's right. Okay, so,
All
all right, so
Get on this, let me have.
Senator Gulick, I'm asking Jen to put up the resolution, the healthcare resolution, that you and I have been, and you've most, started, and then you and I have been drafting with Jen and then brought to the committee. And some changes have been made, so why don't we look at that?
Thank you. Thank you.
No.
Jen Harvey, Office of Legislative Counsel. I don't believe I so we'll just have to look for where they first took it from. And maybe share this quickly with Megan as well.
Let me show you something.
Okay, yes.
Show you that. I have copies.
Okay.
Do you all want copies of that or just one copy?
Oh, no, we want copies of it. I think all of us.
Okay.
Well, why don't we go through it while we're waiting for copies?
Okay.
We can go.
All right, so this is a
draft slightly revised. Senate resolution opposing recent federal actions that threaten public health and urging their swift reversal. Sure. And so I added in some, excuse me, some references to Vermont and sort of to state nature. So in the first whereas clause about withdrawing the US from the World Health Organization, I added in a move that jeopardizes the health and well-being of Vermonters, other Americans, and individuals all around the world. Because of the WHO's focus on improving public health and on detecting, preventing, and responding to public health emergencies, including disease outbreaks that do not respect state lines or international borders. So we've been through that. The U.S. Department of Health and Human Services is eliminating the jobs of approximately 20,000 employees, including at the CDC, where teams were cut whose work focused on preventing injuries and violence from causes including motor vehicle crashes, child maltreatment, falls in the elderly, traumatic brain injury, and drowning, on tracking trends in mental health and substance use disorders, on rape prevention and education, on maternal mortality and maternal and child health, and on many other areas affecting public health in Vermont, the United States, and beyond. The Trump administration has eliminated the entire management and regulations divisions at the Center for Tobacco Products and the Food and Drug Administration, and cut most of the staff at the Office on Smoking and Health at the CDC, which severely hampers tobacco regulation and enforcement efforts and will have a devastating impact on tobacco prevention in Vermont's youth and on Vermonters' public health. And whereas the National Institutes of Health, a part of the U.S. Department of Health and Human Services that describes it as the nation's medical research agency, making important discoveries that improve health and save lives, is now refusing to award grant funds to universities that operate any programs that advance or promote diversity, equity, and inclusion, which jeopardizes the future of medical research and disregards the existence of health inequities. And I have these particularly Vermont things to say there. And whereas the U.S. Department of Education cut approximately $1 billion in federal grants that support critical mental health services in schools, which will dramatically reduce access to these services and threatens the health and well-being of youths in Vermont and around the country. And whereas leadership at the U.S. Department of Health and Human Services lacks understanding of science and scientific research, including of peer-reviewed research regarding vaccines and autism, and therefore be it resolved by the Senate that the Senate of the state of Vermont stands in support of science, opposes these federal actions, and urges their swift reversal. And be it further resolved that the Secretary of the Senate be directed to send a copy of this resolution to President Trump, Secretary Kennedy, and the Vermont congressional delegation.
So these are the changes that have been made after we looked at it the first time to add,
To make it a little bit more Vermont focused, or with some Vermont. I mean, they're federal actions, so it's already Vermont focused, but yeah.
comments. Senator Gulick, your comments first.
I mean, I like it. I'm not 100% sure about some of the claims, although I like them, but I mean, can we say that the tobacco cutting the fund, whatever it was, the cutting of funds for tobacco cessation will have a devastating impact? Are we sure about that? It just seems like a very, I don't know, strong, we think it will have a devastating impact, but will it for sure? So, I mean, things like that. And then can we definitely say that the head of the health department lacks science? Where was it?
You mean HHS?
Leadership at the U.S. Department of Health and Human Services lacks understanding of science and scientific research. Is that true?
Robert Kennedy.
It's for RFK, and for me, it is accurate.
Leadership does not mean one person. I think
Yeah, I mean, that was my
Oh, okay.
It's not just him.
No, you're right. Do you want to say?
That's what I was trying to say, Sam.
Oh, I gotcha. Okay, so what would you say then?
Head of, the secretary of, you know, you can be as.
You would be.
I'm not an attorney. Would we get sued for saying something bad about a specific individual? Like
No, he's
saying that
he's a public official.
Right,
Okay.
you'd have to show actual malice.
Yeah.
okay.
You could
You understand my
We
concern
have
though, we're
no
saying that
offense.
we're,
Right, we're sending it out. I understand.
No, they can say anything about us.
You have to know it was untrue and show and have actual malice. I believe is the standard for a public official.
Right, when you say that vaccines are ineffective against diseases, that demonstrates a lack of scientific understanding, so.
Could we just say the leader of
Right,
department?
what's his title?
Secretary.
The secretary, let's put that in there, let's say where the current secretary.
I'm gonna get education, 1 billion of better grants. That we can, have we actually lost grants?
Huh? I'm getting, this is one.
We don't know.
Yeah,
I'm working on it.
Okay, I know.
Put Vermont in here. I don't actually know.
Yeah, Ginny,
What?
well, if we put that out and it turns out Vermont hasn't lost any grants for mental health, we should check our fact lists. Have we lost grants?
Not yet.
Yeah.
I don't think so, we may have. So the one I like is National Institute of Health. They do all the cancer and, I mean, the pharmaceutical companies aren't doing cancer research.
No, they're not, but the
They do
NIH,
antacids and things that sell. Any research that I've been told for years that gets done is through the National Institute of Health.
right,
So I'll
It
just
is.
take Vermont.
and they have already cut, research programs across
Yes.
the country, which are going to affect us because we're not going to get the data.
They're going to affect our citizens who aren't
Right.
going to get the benefit of new cures for cancer, diabetes, you name it.
Do you want a different word than devastating, like negative, that's a little less categorical?
Yes,
I believe that in journalism, I was told they're called words of color. They have an emotional impact. You're
Right.
not supposed to use them in journalism.
All right, I took out the reference to Vermont in the education cuts and just said
Yeah.
around the country.
right. I mean, the implication, it is affecting us, but you know, we don't
The
know
national
specific.
insurance by the Department of Insurance that describes suspicions.
Okay. NIH, the NIH is really absolutely so.
Yes.
Yes, and I didn't put anything about Vermont specifically in that one. because it's a-
What about diversity and equity in the NIH? Is that we got covered? We're not doing sickle cell anemia research anymore?
That's right. And they're not keeping
Oh, the
track of the
universities
differences between
Any programs?
groups.
My only other comment would be that long list up on page, yeah, this, do we want to include all of these items?
Yeah, that hit me too. It's a lot.
Sure, feel free to direct me to cut.
Can you read that out slowly and we can triage maybe?
Sure.
1 minute.
So this is about the jobs cut at the CDC, where teams were cut whose work focuses on preventing injuries and violence from causes including motor vehicle crashes, child maltreatment, falls in the elderly, traumatic brain injury, and drowning. There's also teams whose work focused on tracking trends in mental health and substance use disorders, on rape prevention and education, on maternal mortality and maternal and child health, and on many other areas affecting public health in Vermont, the US, and beyond.
So maybe make a new sentence, with to begin with on tracking, would that help?
Well, that's why
This also includes tracking trends in,
we'd sort of need a different, another whereas clause.
that's what I'm wondering,
All one long.
instead of one big clump.
Well, I mean, it's all one sentence
Yeah.
in a resolution. So it's, whereas a bunch of things. So I think we generally put a period in a second sentence in the middle of a.
Right, I know. Martine, what are your thoughts there?
I was wondering if what you all would think about just removing, for example, just as an example, motor vehicle crashes, falls in the elderly, just having a couple things there, knowing that it's actually a long list.
All right, here's my suggestion, since we're being called to the floor. We'll take our printed copies of this, and Jen, can we come back to it tomorrow?
Sure. Yeah, it's preventing injuries in violence. And then we go on to motor vehicle crashes. Child.
I mean, we could just take out the examples. We could say I'm preventing, because we're focused on preventing injuries and violence.
And child maltreatment, why don't we just say child abuse? Or
That's not the language that they use.
Child mistreatment.
I mean, we certainly can, the reason we don't currently say it is because that wasn't the language of what I was reading. We can put in child abuse if you prefer.
child maltreatment, I mean.
I think it goes beyond abuse. There's, child abuse, neglect,
Right,
exploitation, etc.
that's,
All right, so you're all gonna look at it.
We'll look at it, we'll come back to it, we want to get it done. There's no question, but we want to make sure it's. Okay,
Thank you, Jen.
Sears.
thank you, we are now adjourned. And we'll get back together because we have to go through 126 together. And we'll have other proposals from the House, so we will get back together. So we are now adjourned.